Hi guys, this is Jason Williams, DO. This is the Williams Family Medicine channel, helping you to live your best life. Today I wanted to talk about genetic testing. Genetic testing is something that's been around for many years, but it is becoming more mainstream. And in fact, there are now direct-to-consumer type of genetic tests that you can purchase. There are many different companies that are offering genetic testing. Some are obviously better than others, some offer more services than others, and it can be challenging and can result in confusion for providers and patients as to what to do in this area. So I wanted to give an overview about genetic testing and how it might be valuable to you. There are some fundamental basic types of genetic tests that exist, and I'll just review some of those. One is molecular genetic testing. This testing looks for a change in a gene, specifically looks at the DNA code sequence. There's also chromosomal testing, which looks at the chromosomes to see if they are missing sections or have duplications or translocations of genetic material on the chromosomes. There are what are called gene expression tests that look at messenger RNA to see if genes are being turned on or off. There are also other biochemical tests to look to see about the activity of enzymes or proteins. For some more definitions, I'd like to talk about the purposes behind specific types of genetic testing and give a few examples of what health conditions you might be looking for or be trying to address with. So you might be doing genetic testing for a particular diagnosis. If you have symptoms and you'd like to classify a certain disease process, then you might do genetic testing for that purpose. Examples might be Huntington's disease and cystic fibrosis. Then you have predictive genetic testing. This is people that are asymptomatic wanting to know what their risk might be for future development of a certain condition. And this might include breast cancer and colon cancer, for example. There are screening tests for asymptomatic individuals, such as a newborn screen for fetal ketonuria. And if this screen is abnormal, then further clarification testing is required. You can use genetic testing for pharmacogenomics, which is an interesting field. In this field, we are looking at how a patient might respond to a certain medication that would be prescribed for their condition. There are many medications that have been studied, and in reviewing a lot of these medications, many of them involve the cytochrome P450 system. These medications include SSRI and tricyclic antidepressants, as well as clopidogrel and many other immunosuppressive type medications. The goal behind this type of genetic testing is to see if you are at risk for a side effect, if you need a higher dose of the medication to get the desired effect, or if the medication just will not work with your body chemistry safely. There's what's called whole genome sequencing, which is very extensive genetic testing that might be undertaken in the case of someone who has a complex medical presentation with an unknown diagnosis. This is probably also something that other people that are very interested in this, that have resources, pay to have done. The cost for these type of tests used to be exorbitant, but is coming down significantly over time. Other common genetic testing is for tumor analysis in patients that have cancer and the medical providers are trying to direct appropriate therapy at their cancer tumor. They do genetic testing to see what drug might be most impactful on suppressing growth or killing cancer cells. Genetic testing can bring up to mind concerns about ethical considerations, and this always is a challenging scenario. If you think about modifying your future, some people would argue that you're overstepping your bounds. I think there are certainly some tools that genetic testing can be helpful for and does not have to create an ethical quandary. I think you also have to understand that genetic testing is not perfect. You will get maybe probabilities about development of certain diseases, but they will never be 100% diagnostic. It is probably best to talk to your doctor before you even consider genetic testing to decide if the question that you want to answer can even be answered with this type of testing, and if you really want to pursue this, have guidance. I think if there's a chance you have a debilitating disease in your future horizon, this may form how you live your life. This may also help you to make changes in your life that can slow down or even prevent certain things from occurring. If you think about the theory of a lot of genetic diseases, you'll hear that the genetics are part of the process and the environment is part of the process, meaning some people have genes that predispose them to certain health conditions, and yet they don't develop these diagnoses where other people do. We haven't figured this all out yet, but we do feel that environment is very important for some of these type of diseases, and we've seen patterns that seem to reinforce this idea. So I want to discuss a couple of examples of genetic tests and how they might apply to some of the chronic health diseases that we have today that impact our lives so greatly. One of those is the ApoE4 gene, and this has been thought to be strongly linked to Alzheimer's disease, as well as some links with cardiovascular disease. If you have one copy of the ApoE4 gene, this may double your risk of Alzheimer's in your lifetime. If you have two copies of the ApoE4 gene, then you may have as much as 12 times higher risk of developing Alzheimer's disease. They say that two copies of the ApoE4 gene also may increase cardiovascular heart disease risk by as much as 45% over the general population. If you're found to have high risk for Alzheimer's disease, there are some interventions that are felt to be helpful for this and are being tried for patients. Some of these include Mediterranean and ketogenic diet, exercise, avoiding smoking, avoiding alcohol, supplements such as DHA, quercetin, resveratrol, vitamin D, vitamin K, and vitamin B supplements. Another common example of genes that we look at and consider in modern healthcare are the BRCA genes. BRCA1 and 2 are the most common. These genes tend to tell about risk of breast cancer, as well as many other cancers, such as ovarian, pancreatic, etc. BRCA gene mutations can increase your cancer risk for breast cancer during your life anywhere from 45 to 85%. There are many other genes that have been implicated with breast cancer as well, and I'm not going to list all of those. You can look those up. If you were found to have a high-risk BRCA gene profile, this could change how you live your life. At age 25, you may start having MRI of your breast annually. At age 30, you might throw in mammograms. After you've had pregnancy, childbearing, and breastfeeding, you may consider prophylactic bilateral mastectomies. It is also common to consider hysterectomy at age 40 to prevent the risk of ovarian cancer. Colon cancer is another area where you might use genetic testing. There is a syndrome called Lynch syndrome. It is estimated that 5 to 10% of colon cancer is hereditary. If you happen to have Lynch syndrome, your risk for lifetime colon cancer is between 40 and 80%. The recommendations then would be to start screening colonoscopy in the 20 years of age and may even have annual follow-up. Another example of where genetic testing can be helpful is Parkinson's disease. It is estimated that 10 to 15% of Parkinson's disease cases are heritable. As we talked before, environment and genetics are probably important. There are some very interesting biomarkers for Parkinson's disease. There are also some physical and clinical symptoms that may make you think that you're at risk for this. I read that constipation predates Parkinson's disease sometimes by 30 years, which is fascinating. History of pesticide exposure and traumatic brain injury greatly increases the incidence of risk for Parkinson's disease also. The implications of a higher risk of Parkinson's might lead you to also follow a Mediterranean diet, work on gut microbiome health, thinking that there may be some type of link between bowel function and Parkinson's disease, exercise regularly, avoid alcohol, and avoid smoking. Ovarian cancer can also be screened for. As we mentioned to or alluded to earlier, the BRCA genes seem to be implicated in this, and possibly 10 to 15% of ovarian cancers may be related to this type of mutation. Studies show that you may have a 60% increased risk of ovarian cancer with these mutations. The implications of this finding might be that you consider prophylactic oophorectomy. Pancreatic cancer is another one that you can do genetic testing for. BRCA genes and many other gene mutations have been implicated in pancreatic cancer cases. And if you have several primary family members that have had pancreatic cancer, it would be very wise for you to have regular screening, as this disease is very hard to pick up. This would be abdominal MRI testing or even endoscopic evaluation of the pancreas. There are many other disease conditions that I've left off, but these are some common ones that I think of in a family practice setting, and these are ones that patients may wonder about themselves. I had a question the other day about MTHFR variant gene mutations, as this can sometimes relate to high homocysteine levels, which has been implicated in increased risk for blood clots and cardiac disease. Homocysteine and the amino acid methionine seem to be implicated. Really, your only treatment is vitamin B12 and folate to help improve this. It is interesting in people that have poorly functioning MTHFR genes, they tend to have a risk for ataxia, peripheral neuropathy, pregnancy loss, and ADHD as well. Since we're on the topic of genetic testing, I learned about a new condition that was found in 2020, and it's called VEXAS, VEXAS. The letters of this acronym stand for the findings in this condition. The V stands for vacuoles, which are little cystic-like structures noted on bone marrow biopsy. The E stands for E1 ubiquitin, which is an enzyme that is affected by the mutation. The X stands for it's an X-linked disorder on the X chromosome. The A stands for autoinflammation. The S stands for somatic, meaning it's an acquired mutation, not a inherited one. This condition results in very severe symptoms that are chronic and relapsing. They include severe anemia, fatigue, evidence of possible bone marrow failure and dysplasia, cartilage dysfunction, inflammation, skin rashes, terrible joint pains, difficulty breathing, and blood vessel inflammation. Apparently, this condition can affect as many as 1 in 10,000 men and 1 in 20,000 women. Discovery of this was first described in 2020. However, this collection of symptoms has probably been around for years. Genetic testing has allowed us to give this a name. It probably can help guide treatment if you have a more standardized approach based on a diagnosis that's accepted. There are many types of direct-to-consumer tests, and some of them offer specific tests, some of them offer more widespread screening tests. You would have to use caution with these tests as they have predictive value but are not perfect. If you are my patient, I hope you found this interesting and helpful. If you're not my patient, please see your own doctor for your diagnosis and treatment. This is Jason Williams, DO. This is the Williams Family Medicine Channel, helping you to live your best life.